It is estimated that 1 in every 50 people are affected by some form of obsessive-compulsive disorder. While some forms aren't extreme enough to cause strain in daily life, those who do tend to fall into one of the following categories. Washers are afraid of contamination and usually have cleaning or hand-washing compulsions. Checkers repeatedly check things that they associate with harm or danger. Doubters are afraid that if everything isn't perfect or done just right, something terrible will happen or they will be punished.
Read this whole book so I can get an A in the test, then I can pass the class, then I can get into college, then I can get a good job, and then I can retire. And if I don't read this book, all of that won't happen. So, go away.
Counters and arrangers are obsessed with order and symmetry. They may have superstitions about certain numbers, colors, or arrangements. Hoarders fear that something bad will happen if they throw anything away. They compulsively hoard things that they don't need or even use.
I should probably, no, I need this. I need this. I don't need that. No, I need that. You could use this for later.
Nick has a form of OCD, which causes high levels of stress and anxiety that he struggles with every day.
This room is so dirty. I should probably clean it up.
What's going on, son?
I was cleaning because the room is dirty.
You need help. You need help.
Yeah, I need help.
Hello, Nick. My name is Dr. Smothers. How are you feeling?
Well, I'm okay right now, but earlier I was really anxious because the house was a mess.
Do you often feel anxious or stressed when things aren't in their place?
Yes, sometimes it's so bad that I end up breaking down and I can't help but to clean it up.
Well, what do you think causes your stress and anxiety?
Well, I worry a lot about things being dirty, and I have to check things often, especially making sure the door is locked at night.
Do you ever worry that something bad will happen if you throw something away?
Picking up where I left off. Yeah, last week I was trying to clean out my car and realized that I might need everything that I had. I didn't end up throwing anything away.
Well, it sounds like you might have obsessive compulsive disorder, dude.
What does that mean?
Well, there are two parts to obsessive compulsive disorder. Obsessions, which are involuntary, seemingly uncontrollable thoughts, images, or impulses that occur over and over again in your mind. And compulsions, which are behaviors or rituals that you feel driven to act out again and again. Usually compulsions are performed in an attempt to make obsessions go away.
Alright, what does that mean?
Well, you try these 4 steps for conquering symptoms on your own. Then, in our next session, we're going to try something called cognitive behavior therapy.
Thanks, buddy. I'll see you next week.
Hello, Nick. How have you been since we've talked last?
Well, I tried what you said about refocusing and trying to ignore the compulsions. It's been a lot easier when I try to distract myself with something else, but I still stress enough that I end up coming back later to wash my hands a few hours later.
Well, that's great progress. You're certainly doing better. Today, we're going to try something called cognitive behavior therapy.
What's that, Dr. Smothers?
Well, we're going to start by having you sit with a dirty pizza box right in front of you. And you will have to overcome your compulsions to clean it up. And eventually, those obsessive thoughts will go away on their own. This treatment is to help you get rid of your obsessive thoughts in a healthy way rather than through compulsive actions. We are going to start by giving you this pizza box. You can't do anything about it.
We can start reading instead. Right?
This pizza box is really dirty. I should probably clean it up.
Try to focus on something else.
I have a very strong urge to throw this away.
It's okay, Nick. Just try to focus on something else. Maybe you can read this book. Just whatever you do, don't throw it away.
Okay, I'll try it. Gee, I feel a lot better.
Nick, how have you been doing since your last cognitive behavior therapy session?
Oh,
Wait.
I've really been distracting myself by hanging out with friends and doing all the things that you told me to do. Well, thanks to your methods, Dr. Smothers, my disorder is now getting very much better, and I feel as though I have control over my own actions 90% of the time.
Good job.
Thanks, buddy.
Is that the whole day?
Gee, my hands are really dirty. I should wash them.
No, son, no! No! Remember what Dr. Smothers told you.
What did you tell me?
I don't know. You're supposed to know.
Do it.
So soulful.
My fire, warm desire me when I say I want it that way. Me up to maybe I should be insane.
Oh my gosh, this room is so dirty. I need to clean it up.